Hi, I'm Catherine, and this is my presentation, Brain Implants, a No-Brainer. A quick overview of my project. So first I'm going to discuss how brain implants work in conjunction with the nervous system, the effectiveness of using these implants, and the side effects and ethical implications. And finally, the future developments of implants. So first, what are brain implants? Brain implants are a form of neurotechnology, and they work by having electrodes implanted deep inside of your brain. Their job is to monitor and manufacture electrical activity. They act a lot like neurons or brain cells, which our body naturally has. And their job is to communicate with the nervous system, which is responsible for your motor function, regulating your internal body environment, like your internal temperatures, and that sort of thing. This is an example here of a diagram depicting DBS, or deep brain stimulation. As you can see, there's lead wires that move from your electrodes all the way to a neurotransmitter. The neurotransmitter creates the electrical pulses that allow your neurons to kind of talk to your electrodes. There's also a handheld controller that is not depicted in the diagram that is used to turn on and turn off the device. For some background information, the brain implants, their goal is to combat the effects of neurological disorders. These can include Alzheimer's, Parkinson's, epilepsy, paralysis, depression, or addiction. For these types of disorders, there is no clear-cut cure for them. Most treatment plans focus on medication or physical therapy to lessen symptoms, but they don't actually get rid of them entirely. Here I have a chart depicting the growth of implants from 2016 all the way to predictions for 2028. And as you can see, the value and prevalence of these brain implants in the United States is predicted to grow. Worldwide, there are 200,000 people wearing a brain implant right now. If implants could improve the quality of life for you or your family members, this is definitely an important topic to consider. In this presentation, I would like to argue that brain implants are the most effective treatment for neurodegenerative conditions. Case 1, DBS. This is deep brain stimulation, which I previously mentioned. It can target Parkinson's, Alzheimer's, depression, addiction, and dystonia, and it's able to target so many different things by targeting different parts of the brain in regards to where the electrode is placed. For example, the subthalamic nucleus, also known as the globus pallidus, is responsible for tremors, stiffness, and your overall motor function, which would make it helpful if you have Parkinson's disease or dystonia to relieve those symptoms. In contrast, if you were to have electrodes placed in the subcallosal cingulate cortex, it's responsible for mood swings and that sort of thing. So if you have depression or bipolar disorder, that would be really helpful to relieve those symptoms. However, some downsides to using DBS, it can cause mood swings or personality changes. In one case, patient X, I'll refer to preserve the patient's anonymity. Prior to having DBS implanted, he had no affinity for gambling, but he developed a compulsion to gamble while he had DBS activated. Only when DBS was turned off was he able to stop gambling and realize the consequences of his actions were harmful to his family. Similarly, there were cases of increased apathy and hypersexuality in other patients. Case 2, implants with neural networking. I'm going to discuss two of these different exhibits in regards to this case. First is paralysis. The goal here in this area is to improve efficient communication for paralyzed individuals. Previously, prior to the topic that I'll be discussing right now in terms of reading minds, essentially with implants, was using a virtual keyboard. For paralyzed persons, the way this would work is they would use their eyes in order to click on a virtual keyboard and key press on different letters. However, this was really hard because the paralyzed individuals had to focus on that cursor, the virtual cursor clicking buttons, and it was very difficult also to determine when a key press actually occurred. Instead, what happens now is using brain implants, we're able to use neural networks or artificial intelligence to map individual letters to electrical activity that happens in the brain with your neurons. By training neural networks based off of that electrical activity, we were able to plot results and use that information to determine when someone is thinking about the appearance of a letter, like the shape of it. They are able to type by recognizing what electrical activity matches with which letter. This allowed them to type up to 90 characters per minute with a 1% error rate. Case 2 is implants with neural networking, continued, focusing on memory though. In this example, the goal here is to improve cognitive function and memory recall. Here we have neural networks focusing on categorizing brain behavior in low functioning or high functioning. Low functioning is when it's very difficult to recall information, and high functioning is when your brain is working well to do that. In a case study, different patients were focused on memorizing a list of different objects, and then afterwards they had a distraction, and then had to come back and say what words they were able to remember. In this experiment, people that used the implants were performed 15% better than those who did not have an implant turned on. Some information on implant surgery. For the surgical process for this, it requires upwards of 4 to 6 hours to perform, depending on where your electrodes are being placed, which again is dependent on the type of neurological condition you're trying to treat. It also may require the patient to be awake for part of the surgery. They'll be sedated during the actual incisions in their skull, but they'll be awake for the electrode insertion. So the way this works is you have a stereotactic frame that is attached to your skull, as you can see in this diagram. There are also imaging scans like MRI or CT scans that happen before we actually cause the incisions to happen. That's to make sure that electrodes are being placed in the right areas. During the electrode insertion and testing process, the patient may be awake. This is so that the patient can actually relay information back to their surgeons, letting them know how their symptoms change when electrodes are in different places and activated. Finally, in closure, they'll be putting plastic cups over the burr holes in the skull and providing stitches. Okay, finally, effectiveness versus risks. In terms of effectiveness, compared to using physical therapy or medication, these directly override unwanted electrical activity, which is responsible. It's the root cause for unwanted symptoms. They also work 24/7 without interference, compared to medication where you have to manually take it on your own, and if you forget, that can have negative effects. They're also adjustable and customizable directly to that person. You can change where these electrodes are placed, which has a better effect than changing a dosage of medication. This also brings me to discuss open loop versus closed loop. When you have a closed loop situation, for example, for depression, an artificial constant state of comfort will prevent the depression from happening altogether. You're not really allowed to feel unhappy because your brain is stimulating electrical signals to make you feel happy all the time. This may have interesting ethical implications in terms of if you can never feel different emotions, does that change or compromise your humanity? But in terms of effectiveness and practical healthcare, this is much more effective than going to counseling or therapy, because you're changing your emotions at the root. In terms of risks in surgery, hard implants and soft tissue can cause bleeding inside of the brain. There's a 1% chance of these lacerations to occur, which I think outweighs which I think the risks, the benefits would outweigh this 1% chance of a risk. This can also cause irritation and inflammation. There's always general surgery risks like bleeding or infection that can occur. But the additional risks that happen, for example, with DBS surgery, parts can wear through the skin since you have your neurotransmitter on your chest. Wires can break, battery replacements would need to occur for the neurotransmitter every 2 to 5 years, and there are also higher risks of infection. In terms of what's next, one of the main goals with the future of brain implants is preventing those lacerations. That's the main risk that people are worried about when they go and get surgery. They don't want to have any bleeding that happens. To prevent this from happening, rather than having hard implants, softer implants might be more useful. The way this works is using materials that seamlessly blend into with the brain. This is to prevent your brain from thinking there's a foreign harmful substance inside of it. So to do this, they used silicone polymers. This is still an in progress development. So there have been tests with rodents and rats, but they use a culinary sugar melting trick that helps to mold implants and caramelize them. And since sugar is non-toxic, it's naturally metabolized by the brain, so it works really well with your neurons naturally. By using this, we can have a higher neuronal density and lower foreign responses that can interfere with the brain implant's effectiveness. In conclusion, brain implants can drastically improve a person's quality of life. They are more personalized, more efficient, and more effective than traditional treatments for neurological conditions. And considering implants for yourself or your loved ones could change their life. Having a neurological condition can make it difficult to do your day-to-day activities. So making sure that you consider all your options, including brain implants, could be very beneficial. Thank you. These are my works cited. On the left side, I have all my academic resources, and on the right side, I have all of my images.